I hope you all are preparing well for your exam. Today we are going to discuss about some of the important questions and answers regarding the topic mood disorder. So let us begin the session. First question. Mania involves boundless, frenzied energy, feeling of euphoria, ideas coming too fast and too many. The answer is option D, all of the above. Boundless, frenzied energy, feeling of euphoria, and ideas coming too fast and too many. All these symptoms are involved in mania. Next question. Depressed individuals exhibit which of the following symptoms? Behavioral symptoms, physical symptoms, cognitive symptoms, and all of the above. In depressed individual, we can see behavioral, physical, and cognitive symptoms. And depression is a mood disorder involving emotional, motivational, physical, behavioral, and cognitive symptoms. Which of the following is a behavioral symptom exhibited by individuals suffering unipolar depression? Actually, unipolar depression is a psychological disorder characterized by relatively extended period of clinical depression which cause significant distress to the individual and impaired in social or occupational functioning. This is about unipolar depression, and options are unpredictable and erratic behavior, compulsive checking, stayed in bed for long periods, and ritualized behavior. The answer is option C, stayed in bed for long periods. DSM-4 criteria for major depressive episode includes which of the following? Actually, major depression is a psychological process characterized by relatively extended period of clinical depression which cause significant distress to the individual and impaired in social or occupational functioning. So the options are symptoms cause clinically significant distress or impairment in social functioning. Symptoms are not due to physiological effect of substance misuse. Symptoms are not accounted for by bereavement. Option D, all of the above is the answer. Which of the following is a chronic mood disturbances that can cause depressive symptoms but does not disrupt normal functioning? Cyclothymic disorder, dysthymic disorder, dissociative disorder, personality disorder. The answer is dysthymic disorder. Dysthymic disorder is a form of depression in which the sufferer has experienced at least 2 years of depressed mood for more than not. So this is about dysthymic disorder. Here the chronic mood disturbances that can cause depressive symptoms but does not disrupt the normal functioning. In the DSM-4, bipolar 1 disorder includes which of the following symptoms? Currently or most recently in manic episode, the previous occurrence of at least one major depressive episode, manic episode or mixed episode. Mood episodes are not better accounted by the psychotic disorders. Option D is the answer, all of the above. Bipolar disorder is a psychological disorder characterized by periods of mania that alternate with periods of depression. So this is about bipolar disorder. In bipolar 2 disorder, major depressive episodes alternate with period of hyperventilation, hypomania, hypothermia, and hypoxia. Answer is hypomania, mild episodes of mania. So the option B is the answer, hypomania. Next question is, in the major depression, which of the following is significant neurotransmitter? Serotonin, dopamine, beta carotene, and acetylcholine. Answer is serotonin, an important brain neurotransmitter. Which of the following neurotransmitter is associated specifically with bipolar disorder? Serotonin, norepinephrine, dopamine, and acetylcholine. Norepinephrine is an answer. It is an adrenal hormone which functions as a neurotransmitter and is also used as a drug to raise blood pressure. So the answer is option B. Next question. Which of the following is one of the most influential theories of depression? Option A, Freud's psychodynamic theory. Option B, Beck's cognitive theory. Option C, Seligman's learned helplessness theory. And option D, Bourne's humanistic theory. Answer is option B, Beck's cognitive theory. It's a theory that argues that depression is maintained by a negative schema that leads depressed individual to hold negative views about themselves, their future and the world. That is the negative triad. This is all about the Beck's cognitive theory and it is also known as most influential theory of depression. So the answer is option B. Beck's cognitive theory proposes that individuals suffering from depression have developed negative schema, lowered level of serotonin, introjected loss, negative social behavior. It is about negative schema. The answer is negative schema and it is a set of beliefs that tends individual toward viewing the world and themselves in a negative way. That is about negative schema. The answer is option A, negative schema. Next question is about Seligman's theory of depression proposed that life experiences could give rise to cognitive set termed introjection, learned helplessness, negative triad, and attribution theory. The answer is option B, learned helplessness. Learned helplessness is a theory of depression that argues that people become depressed following unavoidable negative life events because these events give rise to a cognitive set that makes individual learn to become helpless, lethargic and depressed. So this is about learned helplessness theory. The answer is option B. In which of the following cases has learned helplessness theory been applied to depression? Battered woman syndrome, personality disorder, substance misuse, alcohol abuse. Answer is battered woman syndrome. Learned helplessness theory been applied to the depression of battered woman syndrome, and it is a view that a pattern of repeated partner abuse leads battered women to believe that they are powerless to change their situation. So the answer is option A. Attribution theory of depression proposes that those who are likely to become depressed attribute negative life events in which of the following ways? Internal rather than external factors, stable rather than unstable factors, global rather than specific factors. Answer is all of the above. Attribution theory of depression proposes that those who are likely to become depressed attribute negative life events. And this theory of depression which suggests that those who are likely to become depressed attribute negative life events to internal, stable and global factors. Hopelessness theory proposes that depression can be predicted by negative attributional style, negative life events, low self-esteem and all of the above. The answer is option D, all of the above. Hopelessness theory, it's a theory of depression in which individuals exhibit an expectation that positive outcome will not occur, negative outcome will not occur, and that the individual has no response available that will change the state of affairs. This is about hopelessness theory. One of the major drug therapies for bipolar disorder, chlorpromazine, lithium carbonate, clozapine, and benzodiazepine? The answer is lithium carbonate. Lithium carbonate is a drug used in the treatment for bipolar disorder. Another term that has been previously used for bipolar disorder, schizophrenia, paranoid schizophrenia, manic depression, multiple personality disorder. The answer is manic depression. And the term that has been previously used for bipolar disorder is manic depression, and bipolar disorder previously called manic depression and is a mental illness that is characterized by severe mood swings, repeated episodes of depression, and at least one episode of mania. Bipolar disorder is a what type of disorder? Personality, mood, identity, thought. Bipolar disorder, the option is option B, mood disorder. Bipolar disorder is a mood disorder. People who have bipolar disorder are at the higher risk of also suffering from substance abuse and other mental health problems. Mania is defined as low deflated moods, anger followed by sleepiness, alternating high and low moods, and option D, normally elevated moods. In mania, we can see it is defined as an abnormally elevated mood state characterized by such symptoms as inappropriate elation, increased irritability, severe insomnia, increased speed and volume of speech, disconnected and racing thoughts, increased sexual desire, markedly increased energy and activity level, poor management and inappropriate social behavior. Bipolar disorder includes manic episodes followed by depressive episodes, crime spree, lying, sleepwalking. Answer is option A, depressive episodes. Manic episodes frequently alternate with depressive episodes. In fact, depression occurs more often than mania in many people with bipolar disorder. Sometimes they feel very happy and ups and are much more active than usual. This is called mania. In other times, people with bipolar disorder feel very sad or down. This is called depression, and bipolar disorder can also cause marked changes in energy and behavior. Treatment for bipolar disorder can include painkillers, anti-seizure medications, testosterone, and vaccines. Answer is anti-seizure medications. Treatment for bipolar disorder may include the use of mood stabilizers such as lithium, anticonvulsants, antipsychotics, and drugs that act as tranquilizers are the